As the pandemic tightens its grip on the nation, the president thrust his son-in-law, Jared Kushner, into the limelight at yesterday's briefing. Kushner suggested that the nation's stockpile of medical equipment belongs to him.
The notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. So we're encouraging the states to make sure that they're assessing the needs, they're getting the data from their local situations, and then trying to fill it with the supplies that we've given them.
The suggestion that the strategic national stockpile exists for anything other than the American people in every state who desperately need that equipment invited rebukes from governors across the country and at least one Republican senator, Cory Gardner of Colorado, who wrote this in a letter last night, quote, "The strategic national stockpile is a critical resource for states facing grave public health emergencies, and we must take every step to make sure that there is a robust supply of working medical supplies and equipment on hand." The growing political crisis around the president's response to the coronavirus outbreak in this country is where we start today. From the New York Times, Chief White House Correspondent Peter Baker. Dr. Irwin Redlener is back. He's the director of the National Center for Disaster Preparedness at Columbia University and former Deputy National Security Advisor to President Obama. Ben Rhodes is back. Dr. Redlener, we're seeing something that is pretty jarring, especially, I think, for people like Peter who've covered White Houses in crisis, for people like Ben Rhodes and I who've worked in White Houses during crises. Real alarm from the two top science and health advisors to the president. I thought Dr. Birx sounded her most exasperated yesterday when she said people are not getting it. I thought Tony Fauci sounded defeated last night on CNN when he said, "I have no idea, I cannot understand why at this point there isn't a nationwide quarantine." The day before, you had Mike Pence and Fauci saying that we are most comparable to Italy. I mean, these are the direst of outcomes for the United States of America. Why can't they convince this president to stay on script, or if he can't stay on script, to take a back seat?
Well, I don't think any of us have ever seen anything like this, including very experienced reporters who have been covering White Houses for a long time, including yourself, Nicole. This is, I keep looking at the thesaurus for other things to say, but it's just jaw-dropping. The addition of Jared Kushner into the equation with one of the most ignorant statements I've ever heard from a public official, that the strategic national stockpile was, quote-unquote, ours. I don't know who he was referring to. Maybe he meant the Trumps and the Kushner family, but was specifically designed and set up to expressly provide relief to localities when we're facing a disaster. It was just ridiculous. But, here's the thing. When the postmortem is finally done on what we've gone through here with this response on the federal level, there's going to be three main issues that we're going to be having to try to understand what happened with its entirely messed up ability to produce testing that we needed many, many weeks ago. Especially frustrating the fact that we did not take the offer from the World Health Organization and other countries like Germany to actually give us effective tests. So we're way behind that eight ball. And then our inability to make sure our hospital systems are protected is staggeringly incompetent, but also very, very dangerous. Those frontline hospital workers, including my son, who is an ER doctor in New York City, they're like going to combat every day when they go in for their ER shifts, and it's just inexplicable. And finally, the messaging thing. This is something that from the beginning was literally bizarre, to have the president over and over again reassuring us that everything was under control. 5 seconds later, Fauci would get up and say, well, no, the worst is yet to come. And that exasperation has been going on for a very long time. You got to hand it to people who are professionals, who still stay there and stand at that podium next to the president, who is incoherent, unreliable, and dishonest about the messages he's putting out there. It's staggering, and it's hard to find the words to describe it.
Ben Rhodes, it also, at this phase of a crisis where any individual who is infected, especially one who is asymptomatic, and there's even reporting that the tests that are available, which aren't enough anyway, aren't all reliable. So there are people getting false negatives. every person is wittingly or unwittingly potentially a threat to every other person. What possible explanation is there for what continues to be really a parallel reality? Donald Trump still clearly sees these briefings as the Donald Trump show, not the Save American Lives show.
Well, Nicole, I mean, first of all, if you want to see just how jarring those numbers are, you compare the response of South Korea or Germany to what's happened in the United States, where there was early coordinated aggressive action to deploy tests and to give very clear messaging to citizens, and they've already dramatically bended the curve. And here we are. When I think about this, Nicole, I think about when we were in government during Ebola or other crises, particularly a public health crisis. What do you want? Number one, you want to make sure that all of your decisions are being informed by the best scientists, by people like Dr. Fauci. They're the ones driving the process. Number two, that there is someone who's incredibly competent who is making sure that we're doing whatever those people say. So we're getting tests out. We're getting equipment out to hospitals. And then number three, the president's role is to communicate a very clear and direct message to the American people with no ambiguity about what they need to know for their own health and safety. And what is absolutely astonishing to me, Nicole, is that we all know, especially because we're sitting here on Skype in our homes, we know that the only way to save lives is for people to shelter in place. The fact that we are not there yet, the fact that individual mayors and governors are having to make these decisions because President Trump hasn't been able to convey that message is astonishing, and it's people's lives at risk. It's also, frankly, Nicole, making it such that mayors and governors and other community leaders are having to spend time debating what message to communicate to their people instead of doing other things that need to be done. Think of the opportunity cost of local officials and state officials having to wrestle with something that, frankly, the president should have done weeks ago in communicating clear 50-state national guidelines about what needs to be done.
Yeah. Peter Baker, your paper has some extraordinary reporting on the emergence of Jared Kushner. Now, he had his first public turn at the podium yesterday, but he's been involved behind the scenes for days, if not weeks. Now, that does not instill confidence of close watchers of this White House. He had a heavy role in the shutdown, which didn't end well for any American and certainly not for the president. He's in charge of Mideast peace, which is anything but on track. How did Jared Kushner end up the point man on the White House response on coronavirus?
Well, this crisis came along at a moment of transition in the White House, a moment where there was basically a void at the top. Remember, the president fired his acting chief of staff, Mick Mulvaney, on March the 6th, right? It was this, pandemic was really taking hold, and the crisis was growing really exponentially at that point. He named Mark Meadows, the congressman from North Carolina, a close ally, as his next chief of staff. But Congressman Meadows didn't resign his seat and actually take over the job until just this week. So in that void, of course, you needed somebody to step in. That was Jared Kushner, the president and the vice president, deputized him in effect to create this, what he's calling an impact team to go to HHS, to go to FEMA, try to cut through red tape, try to bring people together. And look, he doesn't have an expertise in this. Obviously, he's not a health expert. He doesn't have the expertise of a general who has mobilized large things. What he does have, though, is the ear of the president. What he does have, of course, is sort of the imprimatur of the president. So when agency officials hear from him, they believe they're hearing an effect from the president. That can be, of course, good and bad depending on how it's played out. There are some complaints, for instance, at FEMA, that when the president hears from a governor or a couple of governors, as he had last week, saying they didn't get these supplies or want these supplies, and has Jared Kushner call them to say, go ahead and ship them, even though these states haven't actually asked for them yet. There's a concern on the part of FEMA that whether or not this is really a national prioritization, whether these supplies are being sent to the right places at the right time based on the whole picture rather than on a phone call that happened to go to the White House. On the other hand, of course, in the absence of anybody else taking on this role, Kushner was able to kind of fill a void. The question is whether now Mark Meadows, having arrived as chief of staff, will assert himself and play more of an active role, or whether, in fact, we'll see more of Jared Kushner. It was really interesting to see him at that briefing yesterday. We don't see him in public very often. The fact that he chose to come out and speak and describe his role was rather extraordinary, but the tape you played showed why that can also backfire if some of the things you say end up striking people as, off-key.
Off-key is an understatement. Peter Baker is being diplomatic. Ben Rhodes, you and I don't have to be. It's galling Jared Kushner had his own press secretary. He's someone who curates his image in a manner that is shocking even for Washington standards. And here's what the New York Times reports about Jared Kushner's conduct in this role. The New York Times writes this: in recent days, administration officials said the Federal Emergency Management Agency has received surprise directives from the White House, including to dispatch deliveries of medical equipment to states that had not even submitted formal requests based on which governor got Mr. Trump on the telephone. This is what Peter's describing. And this is, incompetence. This is stupid human tricks. This is putting your unqualified son-in-law in charge of something until people start dying. And then it seems like it's something far more grave, far more sinister, and far more alarming, Ben Rhodes.
Yeah, Nicole. I mean, I think in any case, when you're dealing with an ongoing crisis, the idea of shifting command and shifting lines of authority and communication is a terrible idea because it's going to send confusion through the government. What you need is seamless coordination between the federal government and the states, but also between all these disparate agencies of the federal government, FEMA, NIH, the CDC, and suddenly you introduce Jared Kushner. And look, we've been talking for years about all the challenges and problems of having someone completely unqualified taking on things like Middle East peace. And now we're literally in a life and death situation of a pandemic, of a potential recession, if not depression, in this country. This is not the time for training wheels. This is not the time to put your son-in-law in charge of something that impacts the livelihoods and health and economic well-being of every American here. So I think what we're seeing is all of the characteristics of the Trump administration that we've been concerned about for years, the disdain for expertise, the disdain for government, the inability to tell the truth. It's all, unfortunately, becoming manifest in this response. It's not what we want. We want people like Dr. Fauci. We want the scientists to be driving this process and hopefully averting worst-case outcomes. But instead, here we are, many weeks into this crisis, with apparently a new person in charge in Jared Kushner, who really has no qualification whatsoever to be there.
And Dr. Redlener, one of his first tests will be what is a near imminent shortage of ventilators in New York. NBC News is reporting that President Trump has said help is on the way in the form of 100,000 ventilators that are being manufactured. But FEMA officials said the bulk of those would not be available, quote, until late June at the earliest. Where will we be by late June?
Well, where will we be by next week, which is in really big trouble in places like New York? They're literally running out of the mechanical ventilators, which are among the very few tools that we have to actually save lives when people have severe COVID-19 infection. So it's late. It's hard to believe anything that comes out of the White House now in terms of certainly things like timelines. The very late implementation of the Defense Production Act is shameful, disgraceful, and dangerous. And there are reports that we're actually selling some of our PPE and ventilators to countries overseas. If that's actually true, and I think it might be, I just don't even know how to compute the irrationality and irresponsibility of acts like that. You know, I can't understand why we got so incompetent. I look back, and maybe I'm not supposed to say this, I'm just a doctor, but, I'm looking back at the impeachment articles that got passed by the House and then acquitted by the Senate. They seem naive compared to the incompetence we're seeing in this pandemic crisis. I mean, it is shocking that we have leadership at the top that would even remotely think it was a good idea to bring Jared Kushner into this equation at this particular time. And that we can't even believe any sort of timeline about things like when will good tests be available and with rapid results come out of them? When will we actually get the ventilators? It's all fantasy land. And I think we're going to pay a very, very heavy price in the economy, of course, but especially in the human toll that this incompetence is going to take on the American people. It didn't need to be this way. It did not need to be like this.
Dr. Redlener, a really quick last question for you. What does your son say, or what do doctors say about the fact that we still don't have reliable or adequate amounts of tests in this country? We are still flying blind, simply treating the sickest of the sick patients.
Well, yeah. So my son is what language can I use on this family show? He's very, very distressed about this. A nurse who he works side by side with died a few days ago of COVID. Michael, who's my son,
so sorry.
admitted his older brother who had COVID, but it's a disaster.
I'm so sorry. Our gratitude goes out to your son and all of his colleagues, and my sympathies for the loss of his colleague, of the nurse he worked with. Dr. Redlener, we'll call on you early and often. Peter Baker, thank you for your stellar reporting and for spending some time with us today. When we come back, the New York Times is out with another stunning piece of journalism, this one on the CIA, and it's warning to the White House that the coronavirus data out of China can't be relied on. And what makes this even harder for the U.S. to fight is that China doesn't even know the true extent of their infections. Plus, healthcare workers across the country desperately protesting today for better and safer equipment as they battle the pandemic on the front lines. We'll talk with a nurse pleading for help. And this send-off for the captain of the aircraft carrier who was relieved of his duties yesterday for sounding the alarm about COVID-19 to protect his sailors. A contrast in leadership, to be sure. All those stories coming up.